नहीं रुकेंगे नहीं रुकेंगे, सबको स्वस्थ करेंगे, पूरा स्वस्थ करेंगे, नहीं थमेंगे नहीं थमेंगे, अब ठान लिया है मंजिल पाके रहेंगे। सबको स्वस्थ करेंगे, पूरा स्वस्थ करेंगे, नहीं थमेंगे नहीं थमेंगे, अब ठान लिया है मंजिल पाके रहेंगे।
Thank you, sir.
Superb.
Killing it.
रईस जी भाई
ये कहाँ से सीखा आपने?
सर स्लोमो एक यूके से है मेरा दोस्त, उन्होंने मैंने इंडिया टूर किया था, वो मोर्चंग बजाते थे, मैं मोर्चंग बजाता वो बीट बॉक्सिंग। फिर जैसन सिंह वो भी यूके से, उनसे थोड़ा सीखा, फिर मेरी स्टाइल से राजस्थान में करना कोशिश की।
बहुत सांस चाहिए होती है।
जी सर। जी आज
कितनी देर प्रैक्टिस की, कितने साल प्रैक्टिस करी?
अभी मैं तो इसमें गाना पूरे में बजा लेता हूँ सर।
अच्छा, इसी में
सारे में
तो आप सीख गए वो खुशी में?
थोड़ा सांस का टाइम ले लेता हूँ बीच में।
हाँ। मैंने देखा आप अपने गाने में भी कर रहे थे, बहुत बढ़िया।
जी सर।
बहुत ही बढ़िया, लाजवाब। ये अलग, ये आपने जो राजस्थान का जो सांस्कृतिक म्यूजिक है उसमें आपने ये मिलाने की कोशिश की है?
जो सर जो पहले गाने हमारे सिर्फ ट्रेडिशनल थे, लोगों को लगता था कि भाई कार ट्रेडिशनल है। अब जो वही गाने पुराने जो दादा दादा ने बनाए हैं, अब उसको अच्छी तरह से बीट बॉक्सिंग के साथ लोगों को पता लगे, लोग डांस करते हैं और लोगों को थोड़ा लाइक्स भी समझ में आ जाता है।
बीच में तो आप रैप भी कर रहे थे, आप तो रैप भी कर रहे थे, बीट
तो
बॉक्स।
काफी हमारे संस्कृति को काफी आगे लाने के लिए बीट बॉक्सिंग भी सहयोग कर।
बहुत कूल लग रहा था, बहुत बढ़िया लगा।
बहुत ही बढ़िया,
थैंक यू।
बहुत ही बढ़िया।
So good hygiene is the first step towards preventing and combating illnesses. Personal hygiene is not only about keeping yourself clean, but also about preventing the spread of contagious diseases. While we all knew the importance of hygiene and washing our hands, the COVID-19 outbreak has overly emphasized the importance of hand washing with soap to reduce the spread of the virus. We have with us Dr. Sunila Garg, Chair, Program Advisory Committee, National Institute of Health and Family Welfare, also member of the Lancet Commission, Sonali Khan, Managing Director, Sesame Workshop, India, Temjan Imna Along, Minister for Education, Nagaland, Ravi Bhatnagar, who's been with us, Rekit, and of course we have Siddharth Malhotra, who is staying on with us for this part of the show as well. And at 1:30, we will also be joined by Dr. Soumya Swaminathan, who's the Chief Scientist, World Health Organization. So I think if we really talk about hygiene, the first thing let me come to you first, Siddharth. When we talk about hygiene, do you think post-COVID we've become more conscious? Has the hygiene quotient really got, and we always said wash our hands, keep our surroundings clean. What are your thoughts on that?
Oh, absolutely. I think during the pandemic, we were just all the time, all the campaigns were there to wash our hands from the youngest child to the eldest in the family knew, it's so imperative to do it. And I think now we've imbibed that culture within our society. I think every kid knows the importance of cleaning their hands for various reasons and the benefits they got from it, even during the pandemic or now. I think which is a positive change. Growing up in my younger days in Delhi, we were quite slightly ignorant about things. We were not so, careful when we were picking up things or when we were playing sports or coming back home. So I think it's a great change, and it's a must to keep the society healthy, to keep younger kids more aware of the infections they could get today. And it's a lovely change and we should encourage it.
You said that fitness helps prevent disease. Show us one bit of fitness sitting in that chair that you can
Yeah,
do.
so I want to suggest you
that's
one
just-
thing. On this chair, you're going to sit every day.
Mr. Bachchan will do this immediately after you. Let's
No,
see.
this is a tip for you, sir. I think
God.
it's an easy tip for you, sir. You just stand up if the chair is strong enough, and you have to hold your feet and do reps.
Oh, God. Simple,
So
yeah.
this is very simple, sir.
Tomorrow we'll do it.
आप पूरे
This
दिन
is for those people who sit on chairs the entire day. Something
Correct.
Like you.
Sir is.
moving
I
about.
asked sir has worked out today and come.
Yeah.
So it's your workout is left, sir.
Yeah.
Are you trying to tell me something?
No, I thought it's a.
But you know what you were saying earlier on.
It's not possible.
What you were saying earlier on, that this whole incentive about washing your hands and all came about post-COVID or during COVID.
Even more, yeah.
मैं ये कह रहा हूँ कि सर ये आया कैसे? Alright. कहीं ना कहीं एक डर था हमारे मन में कि अगर नहीं करेंगे तो ये हो सकता है. हम ये नहीं कह रहे हैं कि आप बच्चों के अंदर डर पैदा करें, लेकिन अगर उनके अंदर एक चेतावनी पैदा कर दें आप जो डर के साथ मिली हुई है, तो कहीं ना कहीं उनके अंदर भी वो आदतें आ जाएंगी जो कोविड के समय आई थी. I just feel that.
Not, in fact, that awareness, no? Yeah,
Exactly.
Yeah.
They knew that if you don't sanitize your hands, you could get ill.
Yeah.
And they're seeing all kinds of terrible examples all over the world.
Yeah.
Basically, you know the consequence.
Absolutely. So if you can inculcate that at a very early age, not give them the fear of the disease or the illness.
Just be aware.
yeah.
So do you think that has been one positive outcome of this whole...
Absolutely, yes.
As you're mentioning that we never
absolutely.
had that kind of awareness.
Yeah.
Now everybody is getting it, right?
Yeah, even though, God willing, the COVID has almost kind of disappeared, but you're still in that habit. You have sanitizers all over the place.
There's
You
more
keep
awareness.
washing your hands,
Yeah.
and wash it at least 20 times. Those habits have now been sort of
Huge
imbibed inside
difference.
you.
Yeah, quite true.
And like earlier, we always said, wash your hands. We don't need to do that. I was telling Siddharth, you have to tell the children, wash your hands. Now I think it's just imbibed in them,
Yes.
whether they come back. So that's a very good habit.
It's
which,
that factor
Yeah.
that, this could lead to something bad,
Yeah.
and therefore let's do it.
yeah,
Yeah.
And I think that needs to be brought in again at a very early age.
at an early age. And earlier, the better. So let me just go across to Dr. Garg. Dr. Garg, we're talking about how important hygiene is. Of course, post-COVID, we all are more conscious. But when we talk about how we talk health for all, tell us how important is hygiene for all, like from pediatric to geriatric?
Thank you so much. First of all, happy Durga Puja to all of you. And this is a very auspicious time. And I studied from Mahatma Gandhi Institute of Medical Sciences, where, hygiene was inculcated right from young medical graduates to over a period of time. And, that it's this very, very important question which you raised that, hygiene is very important. I'll say right from the preconceptional phase to, the pediatric and to the geriatric component. I will also like to tell you one of the real case instances as I was, I just finished my post-graduation in 83 and my husband was a practicing pediatrician. We had a child who was born with low birth weight that was to the tune of 1.5 kg. And at that point of time, we never had advanced services and all. It was, her mother was MA, but the child was, so much low birth weight. Just by training the mother that she has to wash her hands regularly, she only will take care of the child. The nursing personnel will not be, at that point of time, you can imagine the nursing care. I'm talking of 83. So this is where today, I think 2 years back, my husband gets a call that Dr. Saab, the child which you, kind of manage, he has become a district magistrate. So that is what I would like to say, the importance of hand hygiene, importance of mothers managing at every point of time, we only not focus on the children, we have to focus on the mothers, we have to focus on the youth, we have to focus, on the, adults and at every point of time and the elderlies, they are so much dependent. We are not talking of young, old and very old people. So at all point of time, the whole concept of hygiene, hand washing becomes very, very important from a public health perspective. In fact, this has got to become a part, COVID has, kind of humbled all of us. It has propagated a lot of practices. And it has, I will say that basically at this point of time, when we are able to reduce a lot of, diarrheal diseases and also address malnutrition and also reduce, under 5 mortalities because of this. And ultimately, we are able to, healthy child is a backbone of any nation. So that habits which you imbibe in your childhood are going to go a long way in, modifying your behavior in the subsequent years of your life. So that is very, very important, that it is family who has to practice, the practice of hygiene. And it is not only I'm talking of hand hygiene. It is about the hygiene which is starting from head to toe, and particularly which is not much addressed is the issue of sexual and reproductive health hygiene and menstrual hygiene. I will also tell you that I, as a president of IAPSM in 21-22, and I was the first lady president which brought about advisory on menstrual health and hygiene management, where we not only talked about the menstrual health of the girls, but we talked about the alternatives also, like menstrual cups. We also have to think about the impact of these pads on the environment. So many of the girls from academic institutions like All India Institute of Medical Sciences and all, they are using menstrual cup. And imagine a cost of menstrual cup is only 365 rupees, and it is going to last for 10 years. So we have to look from that perspective as well. So overall, we have to talk about the concept of hygiene in a very holistic manner, so that we are able to make a dent on all the mortality and morbidity indicators as well.
Okay, thank you so much for explaining that so well. We've been seeing how music, performing arts make a difference, and, for messaging as well. So, Ms. Khan, I would like to ask you that Sesame Workshop has been working across 150 countries, trying to tell children the importance of the basic things like hand washing. In terms of communication, we just saw how Rais Khanji had performed, and even if it's something on hygiene, how well it came across to us. How effective are these methods of puppetry, music, performing arts in giving a message and actually bringing about a change in the behavior, especially for children?
I think this is a beautiful question. Just remember, children can be engaged if you can really make them happy, make them smile, make them even sing along. Sesame, from its inception, really realized that, if television jingles can, as something that children learn, and it's very common. If I ask you today, which is that jingle you remember from your childhood, you'll come up with your favorite one, right? It's so embedded in your memory, this music, this song. So from that, actually, the founders of Sesame realized that this is how children were learning. It was very basic. And therefore, this became the DNA of Sesame. As we were talking about hand wash just now, I think the washy ad, everybody was saying washy. And that's what children were repeating to themselves. So it's just how engaging you make it and how fun you make it. Children love both these aspects. The Muppets play a very critical role. I mean, I was just enjoying the performance as well just a little while ago. I think everybody of us were riveted and listening and maybe even remembering the words. Children learn like that. So I think for us, this has been the prime way of engaging children with messages. And, we all just spoke about the fear of COVID. I think children were just like sponges absorbing whatever was going on in the ecosystem. One of the biggest things that Sesame was trying to do is reduce that fear, make children understand what it was to look at COVID prevention, hand wash, build those kinds of habits which can go a long way. I just want to emphasize one point that I think the panel was just making about building habits early. Sesame works with children between the age of 3 and 8, and that's the foundational years. If we can build these habits of hygiene and well-being, clean toilets, wearing slippers to the toilet, washing your hands after using the toilet, washing your hands before eating, after eating, they will go a very long way. They are the most important life lessons that we can teach children. And rather than make them boring, rather than make them, like sort of someone just punishing you if you don't do them, make them something that the child can really learn happily. I think that's really critical that we should be focusing on when working with younger children. Another thing is not just that children will learn habits themselves. Remember, it's like an old saying that children are our teachers. They can also teach you. Children remind adults. Children can teach peers about habits. And I think that is something that we can focus on. Just don't look at children as receivers of information, receivers of messages. They can actually be our biggest teachers, reminders of what those healthy habits are all about.
I'd just like to ask the Education Minister of Nagaland, Mr. Elong, You know, there's a misnomer that the northeastern states, or rather the states to the northeast of our country, they are not giving too much attention to hygiene, and the process of hygiene is almost absent there. As the education minister, what are the steps that you're taking that hygiene can be inculcated amongst the children?
Bachchan sir, namaste first of all, and to all the panel that is there. I think the northeastern states not giving much importance to hygiene, I think it is a little bit of a wrong information. But concurring to that, I would like to put this way, that even in states like Nagaland today, hygiene is taken in a very holistic manner. And as we are small people living in the villages, most of our people are living in the villages and on top of mountains and hills. You could have seen even during the COVID, the less number of people were affected by COVID because of our people's strong community initiative to keep hygiene and to be clean and to promote those things. And sir, you would be glad to know that some of the cleanest villages in the whole country are in the northeastern villages, northeastern area. And as an education minister, I take care of higher education. We are very serious about not inculcating fear, but inculcating the right knowledge of holistic hygiene and holistic health. So as students take it as a part and parcel of them learning and getting knowledge in every way. COVID-19 has brought a tremendous change, even in our state. And students are more aware about the disaster that it can bring by not being hygienic, by not being clean. And so, even in the education department, the teachers are teaching the students how to, because COVID has still not been over. It is still not over. And to think that COVID will not come back would be another disaster for us. So hygienic atmosphere is holistically being taught in the education sector nowadays. And like what our madams have been saying, hygiene is not only about washing hands and keeping clean, but also it's about the holistic hygiene which each and every one of us would pursue to keep ourselves healthy, sir.
Thank you.
Could I just ask you a question? Actually, I think Amitabh just clapped when you said that the northeastern states are in fact an example for the rest of the country in terms of discipline, holistic health and cleanliness. And you just don't do it and it's important again what Amitabh was saying, not out of fear, you do it out of consideration for others as well. What are the things that we can, as the rest of the country, learn from you in the Northeast? There's so much to learn, but give us a couple of things related to health that we can learn from you.
Dr. Roy, sir, one of the best way of implicating and doing those things in a region like Northeast or even in the rest of the country is communitization of any health issues. Anything. Sir, in our state, example in a village or in a community, we take it upon the community to keep such cleanliness or hygiene. We narrate a narrative, not just impose. Now, example, through the COVID, one of the great things which the government of India and the health ministry had done was the caller tunes on the phones. Every time we pick up the phone, or we have to make a call, the COVID issue was always in our minds. And that brought a lot of awareness amongst the people. But tackling any issue, whether it may be in the villages or in the colonies or in the, in Delhi and Mumbai, those are the flats, the communities that live in the flats
Right.
can take it up holistically. Because single person's endeavor is sometimes very difficult to do. But when we take it in community-wise, example, we were very aware about people coming in, going out of the villages. That's how we could protect our villages. Nagaland has more than 2,000 villages. And if COVID were to enter, example, then the whole community would be affected. So the community takes the stand that, okay, all the, drainage would be clean. There would be every week a group of young people would clean the whole village, example. And women would go, those who have knowledge would go among the women, those things. I want to let you know, ma'am, the doctor madam who is there are places, ma'am, you are very right. There have been places in our Nagaland, as far as Noklak district, where one of the superintendent of police, one madam, IPS officer, Mrs. Betty, she did a wonderful job. Because in such places, the menstrual hygiene was a very, very big issue. I don't want to elaborate on the media how the problems were. But she took the initiative with the community, with the women, and then today they are able to be hygienic and they are able to, get the benefit of menstrual hygiene without having so many problems and diseases that the women folk in the community were. Right. So the community initiative, Dr. Roy, is one thing which is very important.
Right.
And likewise, people in the hill area, unlike me, all are healthy. What my brother Siddharth was showing, that exercise on the chair, I don't know when I can do that, but I really would one day pursue to try to do that.
You and I, we will do it together day after tomorrow.
Don't mind raising your leg.
Yeah, he just did it.
मैं एक बात रवि आपको ये बता दूं, आपको तो पता ही होगा, तेमजन जी इज ऑल्सो नोन एज द वायरल मिनिस्टर. इनकी स्पीचेस जो हैं वो इतनी वायरल हो जाती हैं, और इनकी हिंदी की स्पीचेस भी, इंग्लिश की स्पीचेस भी, एंड ही नोज हाउ टू हैव फन in politics and also communicate.
Still get your message across.
Yes, that's his strength. So he is a very, very effective communicator. But Ravi, I wanted to ask you, what is Reckitt's plan in the Northeast?
Thank you so much, Sanket, for asking this question. We have been supporting Government of Nagaland for over 3 years by the virtue of our program, which is on the birds and the beestalk. And we are very keen to actually partner with the Government of Nagaland on the Hornbill Festival this year and the times to come. And especially, we want to be the hygiene partners to the Hornbill Festival. And the Zero Festival just got over, now the Hornbill is coming. It will be a very great, opportunity for us also to learn more about the culture, the cultural sensitivities, and to come back and, take this program to the other northeastern states. Under the able leadership of the Honorable Minister in Nagaland, we really think, if the things are great in Nagaland, maybe Arunachal, we will take it there, or, Meghalaya, we will take it there. But, it's a very good state, and people are amazing in Nagaland to start work with. So this is one of the wishes, we do partner with the Hornbill this year. Thank you.
Okay, Temjan ji, thank you very much for joining us.
Thank you very much. Thank you.
Thank you so much. मैं रईस साहब आपसे एक सवाल ये पूछना चाहता था कार्यक्रम की शुरुआत से ही. स्वास्थ्य, अगर आप जीवन में सब कुछ हासिल कर लें, लेकिन अगर आप स्वास्थ्य ही हासिल ना कर पाएँ तो फिर जीवन का कोई अर्थ नहीं है, निरर्थ है वो. मैं आपसे ये जानना चाहता हूँ, कोई ऐसा व्यक्तिगत रूप से कोई वाकया जिसमें आपको ये एहसास हुआ कि स्वास्थ्य पे ध्यान देना बहुत ज़रूरी है?
स्वास्थ्य में मैं तो जहाँ गांव से रहा हूँ, वहाँ से मैं साफ सफाई और सुंदरता के लिए ये तो सबसे बड़े इम्पोर्टेंट है. ये नहीं होगी तो ज़िंदगी इसके ऊपर है. मेरे तो इंग्लिश थोड़ी कम है, ना तो पढ़ा लिखा हूँ, 7th तक पढ़ा था. फिर भी अभी साफ सफाई के जो गाने हमने लिखे हैं उनके बारे में थोड़ा मैं बता सकता हूँ. स्कूल कूल है, एक गाना है जिसमें बच्चों को सीधा वही लग रहा है कि स्कूल कूल, तो बच्चों को सीधा नाम से ही थोड़ा इंटरेस्ट हो गया. फिर कूल है कूल है कूल है, साफ स्कूल जो वो कितरो कूल है। तो ये एक गाना होगा। एक सुंदर घर के ऊपर हो गया गाना, सुंदर घर ना साफ राखो चोखो घणो लागे सा, घर ने करो में बखोड़ी मोरा राख। तो ये सीधा मैसेज, इतना सुंदर आपने घर बना लिया, इसका क्या तारीफ करे, बहुत कम है। तो हैंडवाशिंग वाला वो सुनाया, तो फिर निरोग बनाओ राजस्थान के ऊपर। तो ये गाने सीधे डायरेक्ट हमारे वहाँ राजस्थान में पूरे सीधा मैसेज ही आ रहा है।
These are all folk tunes of Rajasthan. Yes. To convert it into words that are going according to our campaign.
Fantastic.
Just wonderful idea.
Fantastic. Okay, you know, like we've been discussing, habit awareness doesn't always have to be dense or in the form of teaching. You can deploy tools like Rais Saab was talking about, you know, converting folk songs into a message. And now a puppet show is also doing the same, to seamlessly speak about health and hygiene.
इंडिया आयो रे, गांव गांव और शहर नगर में खुशियां लायो रे, डिटोल स्वस्थ इंडिया आयो रे, गांव गांव और शहर नगर में खुशियां लायो रे, ओ खुशियां लायो रे, यो तो खुशियां लायो रे, हो खुशियां लायो रे, यो तो खुशियां लायो रे, डिटोल स्वस्थ इंडिया आयो रे, गांव गांव और शहर नगर में खुशियां लायो रे, स्वस्थ इंडिया आयो रे, गांव गांव और शहर नगर में खुशियां लायो रे, ओ खुशियां लायो रे, भाई खुशियां लायो रे, ओ खुशियां लायो रे, तो खुशियां लायो रे, डिटोल स्वस्थ इंडिया आयो रे।
Yeah, वही।
Okay. Lovely, lovely. At this moment, we are happy to introduce Soumya Swaminathan also. Thank you very much, ma'am, for joining us and being a part of this initiative. You know, we have spoken on a number of occasions when we were discussing COVID, the uncertainty around this pandemic. And now, you know, we are approaching the end, as they say. I mean, the WHO has also said that perhaps this could be, you know, the worst may be behind us. What are the learnings according to you? And are we being very quick to unlearn those learnings?
Thank you very much for having me on this show today. It's an important day, actually, to remember some of the teachings of Mahatma Gandhi, who believed in living in harmony with the environment and basically, you know, in meeting the minimum needs of human beings with compassion towards all living things, which are non-human things as well as plants. And I think the main lesson for me, the pandemic has reminded us, as well as a big other global threat to us, apart from future pandemics, is climate change. And it all boils down to what we've done to our environment. And what human beings have done in the so-called Anthropocene era is basically focused just on human beings. And we have destroyed both the land and the marine environment. And I think for the future, if we are to live healthy lives, it's completely intertwined with the health of our environment. So we need to focus much more as individuals and as governments on protecting biodiversity, on protecting the various species, and not allowing any more species to become extinct, because each one has actually a repercussion on our own lives. The second learning for me is that the vulnerable always suffer disproportionately in any shock. We're seeing now what is happening also with the floods in Pakistan and, you know, with the food scarcity in the Horn of Africa, partly related to the war, but partly related to 5 years of famine. And this can happen to any one of us, any country. In fact, all countries will be affected. And so I think we need to really think about strengthening our health systems with a focus on equity, which means that we look at those who have been traditionally left behind and try and bring the health services to them. And the third lesson is the public health, a public health approach, investments involving the community in any kind of a response, in having good data systems, in being able to act responsibly, and in following science, following data, and really investing, I think, in science and research, because those are the things that paid off for us. Countries which invested in public health and in science research data systems, and very importantly, community engagement and building trust with communities.
I do just want to thank you so much for joining us today. Actually, more than that, for being such a brilliant voice throughout the last 2.5 years. You've joined us regularly and really helped us a lot in trying to understand what this whole pandemic was about. I think when we started, we knew just about 10% of what this COVID was, and we didn't know how to treat it. It was like shooting in the dark. First question is, how much have we learned since then? How much do we know now? Are we 80% clear about this particular virus? Secondly, what have we learned about how to handle these in the future? Are we really ready, or as Sanket just said, we are de-learning and unlearning a lot of the stuff that we learned? And finally, how do we treat the fact that vaccines are also created by profit-making companies? When the whole world needs it, everybody looks actually at their own narrow interest. And we didn't see enough spreading of various vaccines around the world. How do we handle that in the future? There'll be other pandemics, right?
Yes. Thank you very much, Pranoy, and also for the efforts you and your colleagues make in educating people with the facts and updating. And as you said, we've learned a lot over the last 2.5 years, but I think the virus still has surprises in store for us. And one of the things we don't know is exactly how it's going to evolve. The hope is that the Omicron and its subvariants will be the predominant ones, and that slowly the human race has acquired immunity, enough immunity to protect against the severe consequences of this infection, even though we may continue to get repeatedly, just like we get cold every year. The colds are due to the same coronavirus family. Having a cold before doesn't stop you from getting another cold due to a coronavirus, but we don't get sick. And so hopefully this virus will also become something that doesn't sicken the majority of us. Now, there's also the worst case scenario where this mutates so much that it's able to evade our immune responses completely and then again cause severe disease and death. That will mean developing new vaccines, which offer broad enough immunity to protect us. And so that there's a huge enterprise right now ongoing to develop broadly protective vaccines against coronavirus, but also against the other major viral families that can cause future pandemics. So there are probably about 22 viral families, including the family of the pox viruses. We know about monkeypox, but there are a number of other pox viruses. There are the influenza viruses. There are the coronaviruses. There are a number of hemorrhagic fever. We've seen this new Ebola outbreak in Uganda, which is not responsive to the already developed Ebola vaccines. So there are a number of hemorrhagic fevers. There's Nipah. So we need to prepare a prototype vaccine candidate against these major viral families so that if and when there is an outbreak, we can quickly scale up the manufacturing of these vaccines and use them quickly. And the goal is really to shorten the timeline. This time we did it in less than a year, which itself was unprecedented. Next time, the hope is to do it in much less time, maybe 3 months or 6 months. But that means preparation and investment. You asked about the global response. Vaccines have been a fantastic tool in the fight against COVID. But if only we had used them wisely in the first year when limited supplies were available, if we had given them to everyone who was at high risk, the elderly, the frontline and healthcare workers, we would have saved a lot more lives. As such, vaccines have saved, it's estimated that 20 million lives have been saved by vaccines, but a few million could have been saved if we had that global solidarity and a plan to share equitably. The private sector is certainly very much part of the solution. I don't think vaccines can be manufactured at scale without the private sector. But what we need is a governance and stewardship from government and from international agencies. Hopefully in the future, we'll put in place mechanisms, contracts, clauses in the contracts, because all these companies get funding from government. And so their responsibility is then to supply enough doses for global equitable access. And that's really something I hope is a lesson that we've learned and that we can work towards mitigating. And finally, you mentioned that we tend to forget the real risk now today is that we go through a cycle of panic and then neglect. As things start settling down, we get back to business as usual, and then we're in for other shocks. So I think this is the time where both globally as well as nationally, we need to have plans in place, preparedness plans, response plans, investment in all of the systems that we just talked about. And the last thing I would say is that the pre-existing health of the community played an important role in determining how many people died. And even though India had a relatively younger population compared to some of the high-income countries, we have large numbers of people with hypertension and diabetes, non-communicable diseases, which in many cases people don't even know they have it. It's undetected. And this contributed to a higher mortality. You found younger people actually dying of COVID, which we need to make sure in the future that we deal with these silent killers, the silent non-communicable diseases. And I hope everyone will go out, get themselves screened for high blood pressure and diabetes, get on treatment. Of course, it's a lifelong treatment, but we can control it. But also lifestyle is important. So these are some things individuals can do. But of course, there's a lot that we need to do as society.
Ma'am, this is Amitabh Bachchan. I just want to ask, there's been a lot of controversy about the validity of the vaccine. And despite the fact that there are many that have taken the vaccine twice over with the booster are still coming down with the disease. Whereas there are some people of the nature of a celebrity that have refused to take it and are still surviving. Novak Djokovic, to give a, well, sort of an example, the tennis player. And also, the other thing, because there isn't such an excess of the COVID right now, there is some kind of a discussion going on that this is just a common flu. It's not COVID. And until you actually do a blood test, you're unable to find out the exact nature of the disease. I say this with some kind of personal involvement. I have been in hospital for 23 days when the first outbreak happened. I've done 2 vaccinations. I've had the booster, and recently I was down with COVID again, despite the fact that my antibodies were close to 500. How do we explain that? And how do we actually explain that to the common man who feels that the injection or the vaccine is an intrusion into his body? He doesn't realize, and he doesn't want to argue with the medical fraternity and say, why should I take in something which is not going to help me at all?
Thank you very much, Amitabh ji. I think, anything that comes from somebody like you is believed by people. You're absolutely right. They don't believe us so much. As scientists, they think, we change our minds all the time, and we have to as the evidence changes. But this is a very important question. So as I was saying earlier, the vaccines that are developed are actually of very high efficacy and safety, all of them, all of the vaccines that the WHO has approved. We have about 11 of them. And what they do is prevent severe disease. With the virus has been trying all along to evolve. As you remember, we started with an alpha, then we had beta, gamma, delta, and then finally ended up with the Omicron now for the last 8-9 months. Each time the mutations have allowed the virus to try to either attach itself better to the cells in the nose and respiratory tract, or to avoid the antibodies. Like you were saying, you've got high antibodies. But because the virus changes its outer spike protein, it's able to just avoid that and still enter our body and cause infection. But as you gave your own example, because you had the vaccine and the booster, and then you got the infection, this virus was clever. It avoided your antibodies. It got into your system, but it didn't make you very sick. Now, there are, of course, always people who have not taken the vaccine and who haven't got sick. But I think that's just a matter of chance. If you're young and healthy, the chances are that you can still have infection and escape. If you're older or if you have underlying problems, like I was talking about, hypertension, cardiac disease, neurological disease, you're at much higher risk of getting sick. Comparing it to influenza, yes, because that's another respiratory virus. Unfortunately, the influenza vaccines are actually much less effective than the COVID vaccines, only around 40-50% effective. And yet, vulnerable people, elderly, pregnant women, and young children are advised to take it. Today, if you see the death rate due to COVID around the world, it's still hovering around 10,000 a day. That's certainly 10,000 reported deaths. We don't know how many others are dying of COVID without really being tested at all, probably many more. We know that 6.5 million officially reported COVID deaths so far in the last 2.5 years. But you can multiply that several times to get the real mortality, excess mortality figures. So this virus, maybe because we're newly exposed to it, maybe over a period of 100 years, it will become like influenza, or maybe even less than that. But right now, it is causing much more disease and fatalities as compared to influenza. And secondly, unlike the influenza vaccines, these vaccines are more effective. So just because we get the infection after getting the vaccine and the booster, we shouldn't think that the vaccines are ineffective. The reason that we're able to recover in a day or two, go about our life, not end up in the hospital, the ICU, is thanks to the protective immunity built because of vaccines. And some of us have also had natural infection that further boosts the immunity. As time goes by, we'll see how long this immunity lasts. It's possible that it could be very long lasting. It's possible that some people might need an annual booster, especially the older people whose natural immunity tends to wane more quickly. But again, last thing is that there's a variability in person to person immune system, and we don't understand that. When we do these large trials, we look at groups. Today, over 13 billion people worldwide have taken the vaccine, and as I just said, one estimate is 20 million lives have been saved. Since the time that vaccines became available. So these are all analyses that have been based on looking at data from around the world. And if you look at deaths today in the US, still 400 to 450 deaths per day they're reporting. The majority of them are unvaccinated individuals. There's still a third of people in the US without vaccines, and majority of people dying from the disease are unvaccinated. So I think all these facts are telling us that vaccines are helping our bodies to face this virus in a way in which we don't get sick, even if we get infection. And we should be really grateful, because all viruses, we have not been able to develop a good vaccine against HIV, for example, or against some of the other viruses that, are attacking us every day. I just mentioned this new Ebola type of.
Based on what
so we're lucky.
Sorry to interrupt. Just based on what you've just said, a data analysis, just tell us, if you have a vaccine, you may still get COVID, but what is the percentage chance of getting COVID versus not having the vaccine? Is it like you've got a 20% chance if you've had the vaccine, but an 80% chance if you hadn't? What is the data? And if you get it and you've had a vaccine, does it reduce the severity of the illness by how much? What percent?
I just want to add to what Dr. Roy just said. These are very interesting questions, and these are some of the thoughts that are going through within our community.
Right.
One, of course, that is the West more vulnerable to the kind of disease that is spreading through COVID, and we in the eastern part of the hemisphere, and in India particularly, because we are so exposed to a lot of unhygienic conditions, our bodies are becoming more resistant. That is one. The other is that if you had the COVID once before, and I'm again going back to my example, and then had the vaccine twice over with the booster, and then coming down with it again, what my doctors did was, even after they did the first test and found out that I had COVID, after a couple of days, they insisted on doing another test to find out which strain it was, because they felt that they needed to get rid of the strain in order to remove it completely from your body. And that test was done, and it was the Omicron. And another fresh treatment was started, which I'm sure you know because you're in the medical profession. You know, there are 8 capsules a day, 4 in the morning, 4 at night, for about 5 or 6 days. And that kind of gives you the freedom to move around. How does one deal with all this? There are so many controversial ideas and thoughts.
Do you have a follow-up on that?
Yeah. Bombarding with you with more questions. Just from a health and fitness point of view, ma'am, I wanted to ask you if a lot of youngsters around me who are into fitness are very careful of what they eat. It actually stems from Sir's initial question of athletes refusing to take, vaccines at times. Anything that you put into your body, even when we take supplements to, make up for certain vitamins that we don't have, does the vaccine, taking it multiple times, like firstly in my lifetime, I've never taken a vaccine 3 times in a span of 1 year or year plus. Does it take a toll on your body on a hormonal level, or what does it affect you on your what effect does it have on your internal organs from someone who is very fit and healthy, follows a correct diet? That's something even personally I was a bit averse to.
Yeah. I'm just going to add another one to that. You know, a lot of athletes go through tests just before, like say they're an athlete who's going, Olympics or any kind of games, for substance abuse.
Yes.
Is the substance that is going inside our body vulnerable to that kind of testing or not? Because they may unconsciously have been vaccinated and have got some kind of a substance in their body which is disqualifying them
which is banned,
for participation in a particular event.
A lot of questions.
Sorry about that.
No. It's good because there are lots of myths and misconceptions, unfortunately, around vaccines. And I think we have to do much more about answering these genuine queries and clearing doubts. Let me start with health and fitness. Health and fitness is really important for us. As I was saying earlier, that the Indian population, unfortunately, has a very high burden of non-communicable diseases, which are starting at an earlier age. This is because of many factors, our diet, our lifestyle, our physical activity, etc. So what we should aim to do is to be as healthy and fit as possible by having, balanced diet, enough exercise, avoiding tobacco, alcohol, etc. Now that boosts your natural immunity for sure. And so it helps you to fight, the infections that we encounter on a day-to-day basis. What it does not do is give you specific antibodies against a virus or a bacteria, especially if it's a new thing that you've never encountered. Amitabh ji mentioned that in India, we are exposed to a number of pathogens when we're growing up. And Amitabh ji, it's because of vaccines today that we have been able to reduce infant mortality. It's not because that our bodies naturally became immune. If we have fewer children dying of measles, in fact, measles deaths are coming back, unfortunately, around the world. If we have no child suffering from polio in India, if we have reduced the amount of diarrhea and pneumonia, it is only because of vaccines. So natural immunity plays a role, and we have to try to strengthen it as much as possible. But for certain diseases, we need vaccines. And there is a very dangerous trend, to think that natural immunity can protect us. And some parents in the US, for example, did not take their children for measles vaccination or polio vaccination, either based on religious beliefs or because they thought natural immunity is better. They are seeing outbreaks. And you must have heard about the case of the young man who's developed paralytic polio in New York. His parents did not give him a vaccination when he was young. So vaccinology, I think, has saved the maximum number of lives in the 20th and probably will continue in the 21st century. Of course, everything is always a balance between risk and benefit, right? Everything we do in life, if we go out on a motorcycle today, we step out on a bicycle, there's always a risk that we could be knocked down. But we look at the benefits and the risks. Similarly, for vaccines, the scientific community has put a very high premium on safety, because vaccine is something you're giving to a healthy individual, unlike a drug which you take when you're sick. And so a vaccine has to have a very high bar of safety before it is approved. And all regulators around the world and WHO insist on that. Now, of course, there are always rare side effects. I don't think there's any vaccine which we can say is 100%. Nothing in life is 100%, right? So you will have 3 to 4 cases in a million where you may have a clotting disorder, which happens with one type of vaccine, or the mRNA vaccine, which are known to cause myocarditis in young men. It's 3 to 4 per million. But this, if you look at the benefits of that million doses of vaccine and you look at the risks, there's absolutely no doubt. Everybody agrees the benefits far outweigh the risks. And this is true for every new vaccine or drug that's developed. We must look at benefit and risk.
Just one last question, ma'am. How does India compare with the rest of the world as far as the mortality rate is concerned, referring to COVID? And also,
so as I mentioned,
and also, ma'am, the percentage of vaccination that India had as compared to the rest of the world, or let's say the Western world.
Yes. So let's start with that. India has done an incredible job of vaccinating our population, just incredible. To have vaccinated over 1 billion people, in a matter of, let's say, 15 or 16 months, with high coverage of the primary course of immunization is absolutely unbelievable, and the whole world accepts that.
Because of the high percentage of vaccination, because of the high percentage of vaccination to 1 billion people, how does it compare percentage-wise with the rest of the world?
So vaccination is very high, but if you remember, it started in 2021 with just the healthcare workers because supplies were limited, and then it went to the elderly, and gradually it was ramped up. So unfortunately, during the Delta wave in India, most people were not yet vaccinated. Only the frontline workers and healthcare workers, few elderly had received it. And that is why we saw the impact of the Delta wave, because it was a largely naive population. Now, as far as mortality is concerned, we have mortality due to COVID, where the diagnosis is made and it's reported. All countries are reporting that. And we have something like, I think, 450,000, 4.5 lakh deaths, somewhere in that range in India, compared to the 6.5 million globally. But then you have what is called excess mortality, which is the people who died during the course of the pandemic due to many reasons. Some of them may be undiagnosed COVID because, testing was not really widely available, especially in rural areas. And some may have died because they had a heart attack and they couldn't get healthcare in time because the hospitals were full and dealing with COVID patients. So people did die of other diseases. Tuberculosis, case finding had gone down a lot. Amitabh, you will know you're a champion for TB. And so it is expected that many people died because their multi-drug resistant TB could not be diagnosed in time. So that's called excess mortality. And there it's pretty high. So globally, we say 6.5 million deaths due to COVID, approximately 18 million, so 3 times, actually people who died due to some reason. And similarly, in India also, it's somewhere in that range, that 4.5 lakh, died of COVID, but probably 3 to 5 times that many died of other diseases. There are many estimates. And the only way to know that is really to strengthen our death reporting systems, our death registration systems, which are still weak, in most states. And that's something that I think government is going to focus on now. So you mentioned drugs also, Amitabh, and it's interesting that drugs were slower to develop than vaccines, but eventually we did get some drugs towards the end of 21, beginning of 22. We have the Paxlovid, which is made by Pfizer, and then Molnupiravir, which is being made by many Indian generic companies. Those help to reduce the severity. So you said your doctors advised you to take it. Again, if you're in a vulnerable age group or you have some underlying illness, taking the drug when you get the infection may prevent you further from getting sick. So being vaccinated and boosted is very good. The third dose of the vaccine, the booster dose, is very important to have a longer lasting immunity. But for some people, taking the course of drugs when you get infected may also help you from getting really sick.
So we have another 20 questions for you. Thank you very much. That was really interesting. Thank you.
Thank you, Dr. Swaminathan. Thank you so much for joining us. And we thank Dr. Sunila Garg also, Sonali Khan also for participating in this discussion. Thank you very much to all of you. We'll take a short break at this moment, be back with a lot more.
नहीं रुकेंगे, सबको स्वस्थ करेंगे, पूरा स्वस्थ करेंगे, नहीं थमेंगे, अब ठान लिया है, मंजिल पाके रहेंगे, नहीं रुकेंगे, सबको स्वस्थ करेंगे, पूरा स्वस्थ करेंगे, नहीं थमेंगे, अब ठान लिया है, मंजिल पाके रहेंगे, मंजिल पाके रहेंगे, मंजिल पाके रहेंगे।
आदरणीय मंच और आप सभी को मेरा नमस्कार। और मेरी खुशनसीबी है हमेशा की तरह इस साल भी इस मैराथन का टेलीथॉन का हिस्सा बनने की। एंड उम्मीद करती हूँ अभी आपसे वही प्यार मिलेगा जो आज तक मिलता है। सुख दुख झूठी, धन भी झूठी मोहमाया, सच्चा मन का वो कोई ना जाने, प्रेम
This was brilliant. Good to see you in person also. Yes. Aye.
Thank you so
Yeah.
much.
Palak, please, if you could just stay.
बहुत बहुत बस बहुत बहुत बधाई आपको
Thank you, sir.
कभी भी आपको अपने ग्रुप में यदि किसी और कैंडिडेट को चाहिए नाचने के लिए ये है भाई Roy genuinely I saw him moving in that chair to the rhythm and the beat of the song. It was really fantastic. I mean, you know, whenever you feel like it.
say this publicly. You said it.
Okay, I'm sorry.
But Palak, you know, सिंगिंग तो आपका एक हुनर है ही, वो हमने देखा भी और कई फिल्मों के गानों में भी हमने सुना है, लेकिन उसके अलावा आई थिंक इट विल बी इम्पोर्टेंट फॉर पीपल टू नो द सॉर्ट ऑफ वर्क यू आर डूइंग फॉर हार्ट एंड कैंसर पेशेंट्स. So would you like to tell us a little about that?
Yes, so I've been running this mission which is called Saving Little Hearts. So ever since I was 7 years old, I've been singing for heart patients. So all the remuneration from my concerts goes for the surgeries of patients who are suffering from heart diseases. And so far, 2,522 patients have been saved through my concerts. It's a mission of me and my
Since
brother.
you've been a little kid.
Wow. Fantastic.
Thank you.
I think this is a great initiative. So you give the proceeds for
the surgery.
For their research. Okay.
Yes,
Fantastic.
and I personally like to be there in the operation theatre. So doctors allow me to be there in the surgery, and I pray and I chant mantras, and I stay connected with the patients also. It's like a family of more than 2,500 children now.
Fantastic. This is fantastic.
Thank you.
Absolutely
Like
fantastic.
she's saying the the funding or the money, but most importantly, being with them.
Being there,
You know, the
exactly.
thought, the
Yeah, yeah.
attachment. I think that
It's not
connect
just
is
about
even. Yeah, it's not about just
giving the
getting it
proceeds
done,
of the-
and to
Yeah.
ensure that's just amazing.
This is fantastic.
Thank you.
Thank you so much, Palak.
Thank you.
Thank you so much.
Thank you.
Absolute honor. Okay. ये कार्यक्रम आगे ले जाते हैं और आपको बताते हैं that last month Dettol launched India's first and largest hygiene Olympiad, which reached 24 million children in 850,000 schools, 850,000 schools across India. The main aim of this program was to assess awareness of hygiene practices through an exam, identify hygiene gaps, and encourage children to learn about the importance of hygiene in their lives. The first edition of the Dettol Olympiad just concluded, and we are joined by some of the winners. I would like to invite them on the stage. Janvi Patel,
Please come.
Lesh Ram, Salona, Anil, Anshika, Kajal, and Arpit Pandey. Please come up on stage to receive your prizes. Let's give a big round of applause. These children are the future of India, the hygiene champions and the custodians of a healthy future, passing the message on within their schools, their homes, their communities, and eventually through the country.
Sir, आप आइए ना please.
Janvi Patel.
So sweet.
Vishran Solana.
Should I?
Lesh Ram.
Maybe come this side.
इधर आप इधर आओ. Come. आप पकड़ लो.
अनिल.
गिराना मत.
Excellent.
इधर आ जाओ, बीच में आ जाओ.
Enjoyed that a lot.
हाँ ऐसे खड़े रहिएगा है ना
There's another one. Are there more?
थोड़ा सा और खुल जाएंगे हाँ आइए आपका नाम अंशिका
Oh, there's another one. थोड़ा इधर कर दो.
काजल इसका सर्टिफिकेट
Wanna come little this way?
अर्पित आप लखनऊ से हैं
बहुत ही जबरदस्त. और जो बच्चे यहाँ पर हैं उनको तो पुरस्कृत किया गया है. इसके साथ साथ अगर आप मेरे पीछे ये देखें, ऑनलाइन माध्यम से बहुत सारे बच्चे हमारे साथ जुड़े हैं. दे आर ऑल्सो विनर्स ऑफ दिस ओलंपियाड. सो बिग राउंड ऑफ अप्लॉज फॉर देम ऑल्सो. रंजीत, लालनुपी, आशिका, From Sikkim, we have students Louis Singh from Manipur and Vani. Thank you very much. And congratulations. Thank you so much. Thank you. Aye.
Thank you.
Please, come.
Do they want to
Aye,
take a
come.
picture?
उनको बोल देते हैं कि ये नीचे
यहाँ से नीचे. Congratulations.
They need to take.
We'll stop for a short break at this moment, but this program continues. Stay with us.
नहीं रुकेंगे, नहीं रुकेंगे, सबको स्वस्थ करेंगे, पूरा स्वस्थ करेंगे, नहीं थमेंगे, नहीं थमेंगे, अब ठान लिया है, मंजिल पाके रहेंगे, मंजिल पाके रहेंगे, मंजिल पाके रहेंगे।
एक बार फिर से आपका स्वागत है इस कार्यक्रम में। हम लगातार ये प्रस्तुति आप तक ला रहे हैं, अलग अलग तरीके से चर्चा करने का प्रयास, और पिछले 9 सीज़न से लगातार ये प्रयास हो रहा है कि किस तरीके से बनेगा स्वस्थ इंडिया। इस भाग में मैं स्वागत करना चाहता हूँ, हमारे साथ अभी भी मौजूद हैं सोनाली खान, आप मैनेजिंग डायरेक्टर हैं सेसमी वर्कशॉप इंडिया की, दिलेन गांधी, रीजनल मार्केटिंग डायरेक्टर साउथ एशिया हेल्थ एंड न्यूट्रिशन रैकेट is now on stage with us, and Uttara Bharat Kumar, Senior Technical Advisor and Social and Behavior Change, Johns Hopkins Center for Communication Programs, Bloomberg School of Public Health. Thank you very much, Uttara, for joining us.
Thank you.
And of course, the two legends right here. Continue to be here.
This is 2 in 1.
आपकी बात हो रही है.
2 in 1
बात हो रही है.
एक सोनाली खान जी, मैं आपसे एक सवाल ये पूछना चाहता हूँ कि अभी हमने थोड़ी देर पहले देखा यहाँ पर बच्चों को हाइजीन ओलंपियाड के लिए सम्मानित किया गया। ये जो बिहेवियरल नजेस हैं कि थोड़ा सा प्रोत्साहन करना, थोड़ा सा बताना, ये कितना ज़रूरी हो जाता है?
एक चीज़ जो हमें याद रखना पड़ेगा कि बच्चों के साथ थोड़ा सा नज चाहिए। इफ़ यू रिमेंबर कि बच्चों को अगर आपको भी बोला जाए कि खेलते हुए बच्चा घर आता है, उसको माँ याद दिलाती है या कोई भी बुजुर्ग घर में, हाथ धो लो बच्चा, so then he'll go and wash or she'll go and wash her hands. Otherwise क्या होता है, वो झट से कुछ एक केला पकड़ लिया, बिस्किट ले लिया, and they are very busy eating it. So बच्चों के लिए थोड़ा सा repeat memory, मतलब बार बार उनको याद दिलाना, telling them about that they need to do this good practice to build a habit becomes very important. जैसे अगर आपको कहीं टाइम से पहुंचना है और अगर आप हमेशा लेट जाते हैं, so then it's a habit that you have developed. So how do you start becoming a punctual person? It's similarly, how do you always remember to wash your hands is something that we develop through reminders, through repeated practice. अगर खुद नहीं जल्दी से सीख पाते हैं तो याद तो दिलाना पड़ेगा. So that is very essential in habit development in anybody, not just children.
Ji, Uttara, you have worked extensively on this concept of behavioral nudges, and you've done it across countries. Is there any comparison that you would like to draw or tell us what should one learn or not learn?
Good question. I think behavior is actually very complicated, human behavior. I think we behave irrationally mostly. So there's a whole science to studying behavior called behavioral science. Just like doctors study medicine, behavioral scientists study behavior. So oftentimes communicating it is a science and an art. And I think across countries, the similarity that I've found is entertainment education is a very effective tool. So when you move people from, just knowledge to approval to, practice, and then practice to sustained practice when it becomes a habit. All of these stages can happen very systematically if you design programs around it. And just like Sonali was saying with puppets, with entertainment through film, through so many other sources, entertainment is something people in every country love. And it's a great way to bring behavioral nudges and behavioral changes and even habit creation. So I think there's a commonality in the way we can approach behavior, but it has to be systematic and scientific. I think what we tend to do is we design medical clinical programs and tend to put out a poster or a leaflet and then say we've done communication. And as we all know, especially those of us sitting here, communication doesn't happen one time. You have to repeat it many times, remind people, give them different ways of finding things and so on.
Amitabh asked earlier is that should you use fear or should you avoid fear or whatever works? Like when we were kids, when he was a kid, not long ago, people used to say if you do this, the big bear will come and you, so then kids, but is fear a bad thing to use or whatever works?
Fear is not a bad thing, but it has to be balanced with something we call self-efficacy. Self-efficacy, your ability to do something for the fear. So when you have too much fear, the theories we have show us that you tend to ignore the risk. Like when you put cigarette packet warnings, you see it's so much fear without giving people the tools to overcome that fear, right?
बचपन से ही हम लोग को बताया जाता था ना, खाना खा लो वरना वो आ जाएगा, गब्बर आ जाएगा या शेर आ जाएगा, तो ये तो बचपन से हमको बताया गया है।
हाँ।
तो कहीं ना कहीं ये fear factor जो है ये I just feel कि one of the reasons why this is being so effective is that they know and they've been told. The consequences of
but it's
not
important to
doing
know. The fear is very important. You're right, sir, because unless people think it's a real threat, they're not going to do anything about it. So for COVID, for example, when it first came in, we all thought it won't happen to me. It's not a big deal. It's happening only in China. And once we started to think that it's going to happen to me, then you started to feel the fear is real. Then you say this fear, this could happen to me. Then you start to think, what tools do I have to protect myself? So if we don't give people protection tools or behaviors and instead keep the fear very high, the chances are you tend to ignore the fear and put it away. This won't happen. Heart attacks, all the non-communicable new diseases, if people don't feel the threat and the fear without the balance of self-efficacy, they're going to just say, oh, this is not going to happen to me and forget about it.
Balance is very important.
Very
We do know hand washing or even basic hygiene is very, very important. It is a priority. How do you all keep innovating the message? Because it is really, really critical.
I think, of course, we've heard a lot about how hand hygiene is really important. There are so many diseases that could be prevented by the simple act of hand washing. In fact, I was reading the other day that the risk of diarrhea can reduce by 47% if hand washing as a habit was adopted. Now, Dettol has been at the forefront of driving that change or adoption of habit. And I actually want to pick up on what Uttara said to answer that thing. So Dettol actually provides the tools to the point that Uttara was making, that it's not just enough to make you aware of the risk, it's also important to equip you with the tools to deal with that risk, and Dettol has been doing that. We obviously have a soap product, which is what we launched with. We then got in a liquid gel product, which is more effective. We launched a foaming product, which makes hand washing fun, which is a barrier among a lot of children. As we spoke to mothers, we found out. And then we recently launched a 10 rupee powder, which now enables access to hand washing to a much larger group of people. All you do is you mix that powder into water, plain water, and it converts it to a soap, which you can then use for hand washing. So a plethora of products is what tools is what we provide. Apart from that, of course, there's the knowledge. Again, I build on what Uttara said. It's important that we package the fear with the motivation of what is the positive that comes out if once you avoid the fear. And that's what our communication intends to do. A great example of that is all the work that we've been seeing. The Hygiene Olympiad, for example, is a great example of that, where once you learn about the hygiene habits, your adoption of the hygiene habits becomes more seamless, and you get rewarded for it in the form of a certificate, etc., which can lead to other benefits for you in the future. So I think it's a combination of both tools and knowledge that we continue to evolve in order to help drive the behavior change that we need.
Tools and knowledge, and I think when you do it in a play way, I think any kid just wants to. I think it's easier to understand. What do you think, Mr. Bachchan? Like, agar koi kahani ho ya koi aur zariya ho, even if it's music or any way, do you think it's more impactful? Like, if you have the tool to spread awareness, it'll make a better impact?
कहने में बड़ा अजीब लग रहा है लेकिन आजकल कहानियाँ जो हैं वो चलती नहीं हैं, कोई मानता नहीं उनको। वो कहते हैं आप क्या बोल रहे हैं, आप ठहर जाइए, वो गूगल करेंगे, उसका पता निकालेंगे। तो दैट होल प्रैक्टिस यू नो ऑफ नाइट स्टोरीज एंड स्टोरी टेलिंग, देखो एक था राजा एक थी रानी, वो सब धीरे धीरे गायब हो रहा है।
ये आप सही कह रहे हैं। तो उल्टा सवाल आ जाता है।
या यू नो, सो इट्स बेस्ट टू यू नो टेल देम द फैक्ट्स, आई फील, एंड दिस जनरेशन is far too smart.
They're smarter than us.
And they're all smarter than us. And they start at a very young age.
Correct.
I mean, kids are 3 and 4 running the iPads and stuff like that, and dialing numbers on their own, going to the contact list. I mean, it's just unbelievable. So it's better to tell them the facts and be very honest about it. Till the age of 5, I believe, you know, a kid is able to imbibe whatever you tell them. So that's a good age.
After
to
that,
that's when they start going wrong.
नहीं, ये जो नज वाली बात थी, इस पर हम ये बता दें, ये एक कॉमिक है जो कि दिलेन में भी, we all have a copy of this, and this is the very beloved Chacha Chaudhary right here, which Javed Jaffri ji is also reading there in the audience. But if you see that this comic book was very, very famous in India, and now the comic book, the point जो अभी आप कह रही थी उत्तरा, this is a sort of a nudge. लेकिन कहानियाँ, जैसे अभी बच्चन साहब ने बोला कि कहानियाँ शायद उस तरीके से अब नहीं चलती कि आप कुछ भी बोल दें और ये उम्मीद करें कि वो सुन लिया जाएगा और समझ लिया जाएगा, और गूगल नहीं होगा, गूगल होगा.
So tell me, what would you do? What nudge? Can you do a comic on a person sitting next to me on the flight? Everybody was wearing masks. He was watching a video, and everything was fine. But every time he coughed, he'd pull down his mask, cough, and then put his mask up. What do you tell him?
What would the best nudge
Get off the plane.
Midair.
No, so what sort of nudge works, Uttara?
So I think one of the things we need
Or do you have to update the nudges also?
You do need to update the nudges. So I think it's specific to audiences. So you need to find out in your group the desired behavior and what is the barrier to practicing it. Because it could be different barriers for different people. Some people may not be wearing the mask because they don't know or they don't understand the protection. Others are wearing it or not wearing it depending on what others around them think. Someone else may have, so understanding a person's barrier and addressing that is important for the nudge. It's not the same nudge for every group of people. Right. So I think one size doesn't fit all, and we need better research, behavioral research, to understand that.
So we are talking about what really works. Like Mr. Bachchan, you said maybe a story doesn't, move with time, and like you said, you need to keep upgrading it. So Nali, if I could ask you, what according to you think really works when we talk about behavior nudges or when to give across an important message? What works?
I just want to comment on the factor of fear. I've been listening to the panel for a while. If fear was such a great impact, I think we would be such an amazing society. But it's not true. I think as soon as you remove the fear, there's a whole slip back, right? So if you remember, you won't smoke before your father, but when your dad is not there, quickly you'll pull out your cigarette. So it's just the way human mind works in a very complex way. When we are working with children, I don't think fear is necessarily the best mechanism to build habits in children. I mean, there may be contrarian views, and there was this famous adage that spare the rod and spoil the boy. But I think fear creates its own challenges that are huge. It can create a toxic environment. Actually, toxic masculinity is a huge byproduct of fear and a lot of pressure being put on boys and girls. We really need to understand that the more enabling the environment is, the more conducive it is, the child is able to grow. I think Mr. Bachchan just pointed out that, when we are talking about early years, the first 5 years in a child's life, it's when, as brain science shows, that the brain is developing the fastest, child can learn multiple languages, multiple behaviors, is imitating. Every year in a child's growth is a milestone. Can you imagine a child who was crawling is able to stand and walk, which all of us as adults take for granted. We don't even remember crossing that milestone ourselves. But it's such critical. A 2-year-old, a 3-year-old, a 4, every year the child makes a quantum jump in what that child is learning. If we are able to put in the right sort of ingredients including behaviors, I think we will have a better generation. Saying that, I think the other comment on nudges, I think this is a fancy word. We love our buzzwords, right? So we pick up behavior change, behavioral sciences, nudges. These are all buzzwords that we see around us. But I think it's very critical for us to take a step back and ask ourselves this question. And when I was listening, a very funny story came to my mind, despite us being a little bit cynical about storytelling. But this was something, a friend said that if you see someone wearing a mask in an international airport, COVID, no COVID, it's most likely going to be a Japanese. Ask yourself this question, why? I think there are lots of viral videos on why Japanese do what they do, but this is a really interesting story. Because for them, they respect everybody else. Like this whole thing on coughing, that if you're not well, or you're little, like you've got a cold, they wear a mask. They don't need COVID as a reminder. So I think this is the question we need to ask ourselves, how much respect do I have for the other? Yeah. So if you're talking about behavioral nudges, I think there has to be deeper understanding of our own culture. We are a culture that talks about respect extensively. There are a lot of ingredients within our own culture that pushes us towards certain kind of behavioral patterns. I think we need to draw on those. We need to pull from those and then talk about these things, because we are a community that likes to clean our house but put the dirt outside. So I think these are where I think certain critical questions for us are, that how as a community, how as a culture can we draw those nudges that encourage us to really sort of adopt clean practices for ourselves, but raise children in a particular way that is not sort of based on fears or based on expectations that are, pushed from somewhere else, but a deeper understanding. And the child is capable of understanding if we don't dictate terms to them. And I just want to sort of reflect on that. Children are reasoning all the time. So if you just tell them, don't do something, they are not likely to listen to you.
And like Mr. Bachchan said, Sonali, that it's best to tell them the facts. I think just going back to them rather than going around it, telling them the facts is the best thing. And joining us now is Dr. Jyotsna Sistla, Manager Purpose Programs at Reckitt. And she has come up really with this cool idea, very innovative idea of teaching children about health and hygiene through this comic book which we were talking about. Jyotsna, tell us, where did you get inspired, or what was really the thought behind this?
Well, we've been running the school program. We've been using that hygiene curriculum that we developed for the past 7 years now, more than 7 years. But, the one constant is change. And the one thing that hasn't changed for kids, despite everything that has changed around us, is that kids love stories and they love comic characters. And Chacha Chaudhary is one character. He cuts across generations. That group of characters, they cut across generations. Everyone loves those stories, that combination of common sense and magic. And that's why we thought that, we were looking at different ways to communicate. How do you communicate the message better about hygiene? And stories are what we came up with. And the result is in front of you. We've come up with these stories.
सिर्फ चाचा चौधरी नहीं है इसमें, मैं देख रहा हूँ पूरा पिंकी भी है, बिल्लू, साबू,
पूरी पलटन है.
All the characters are there.
Yeah.
बहुत स्मार्ट हो गए आजकल बच्चे सब. हाँ. क्या करें उनके बारे में? जहाँ शुरू कीजिए एक था राजा एक था रानी, बोलता है अच्छा भैया बता दो कितने राजा रानी थे ताकि पता चले कितने दिन आपको सहना पड़ेगा. They become just too smart.
इसमें अमिताभ जी, आप 90s में आपका वो जो गाना आया था वो पुरानी अवधि गाना है, ईर वीर फत्ते.
हाँ जी.
लेकिन अब मुझे नहीं लगता कि आज के दौर में कोई उसको उस तरीके की तरजीह देगा
जी.
लेकिन रोचक वो हमेशा रहता है. हाँ, ये तो सुनने में मजा आता है. मैं स्वागत करना चाहता हूँ जावेद जाफरी जी का. जैसे अभी मैंने थोड़ी देर पहले बताया था, मैं देख रहा था, कौन यकीन करेगा, इनको देख करके ऐसे लगता है ऐसे बस 20-25 बरस के ही हैं. एकदम एब्सोल्युटली फिट एंड हेल्दी. परफेक्ट मैस्कॉट फॉर बनेगा स्वस्थ इंडिया.
बनेगा.
थैंक यू वेरी मच. मैं क्या बच्चों के पास कॉमिक बुक है? जावेद जी बहुत ही अच्छा काम करने वाले हैं. आप बच्चों को ये जो कॉमिक है जिसके बारे में हम बात कर रहे थे, वो कॉमिक पढ़ के सुनाने वाले. ये कुछ कॉमिक बुक्स हैं, लाइए. So I'll distribute this to them. आपको कौन सी चाहिए, हिंदी वाली कि इंग्लिश वाली? हिंदी? अच्छा, लो. ये तो बाकी सब इंग्लिश की हैं. Anyway, let me share this with you. Huh?
Oh, they have the Hindi one.
Yeah. ये लीजिए.
चलिए, ये आप यहाँ पे खोलिए, स्वच्छता स्कूल में खोलिए.
ये लो.
स्वच्छता स्कूल में उसको खोलिए बीच में. दूसरी कहानी.
There is no Hindi left. You give this to me.
ये स्वच्छता स्कूल. दूसरी कहानी उसको पहले, इसके बाद देना. आगे बढ़िए. नहीं, थोड़ा पहले.
All right, so this is going to be a comic reading session, and Javed ji, the stage is yours.
Thank you very much. I'll just begin with them and then we'll probably. Okay, बच्चों, तो आज हम ये बनेगा स्वस्थ इंडिया जो इसका अभियान है उससे जुड़े हुई एक कहानी सुनेंगे जिससे हमें ये पता चलेगा कि स्वच्छता का महत्व क्या है, कितना इम्पोर्टेंट होता है स्वच्छ रहना स्कूल में. और इस कहानी का नाम है स्वच्छता स्कूल में. ठीक है, तो आप भी पढ़िए, मैं पढ़ूंगा. और इसमें कई किरदार हैं, टीचर हैं, प्रिंसिपल हैं, चाचा चौधरी हैं, और फौलादी सिंह हैं, शक्तिमान हैं, बच्चे हैं, और बहुत सारे कीटाणु हैं. तो मैं सारी आवाज़ें निकालूंगा, अलग अलग आवाज़ें उनकी, ठीक है ना. और कहानी पढ़ते हैं. तो स्कूल में शुरू होती है क्लासरूम में, और टीचर बच्चों से बोल रही है.
बच्चों, पेड़ों में हमें अच्छू. टिंकू, तुम्हारे पास रुमाल या टिश्यू पेपर नहीं है क्या? सॉरी मैम, भूल गया. जाओ अपने हाथ साबुन और पानी से धो कर आओ.
टिंकू जैसे ही बाहर गया तो आवाज आई,
बचाओ बचाओ.
बाथरूम बहुत ही गंदा है, यहां तो कीटाणु ही कीटाणु है. सभी बच्चे बहुत परेशान हैं.
उफ़ो, इतनी गंदगी, भागो.
तभी प्रिंसिपल सर क्लासरूम में आते हैं. ये कैसा शोर हो रहा है?
हमारे स्कूल में कीटाणुओं ने हमला कर दिया. जगह जगह गंदगी और कीटाणु हैं. बच्चे बीमार पड़ रहे हैं, कुछ करना पड़ेगा.
प्रिंसिपल चाचा चौधरी को फोन मिलाते हैं. चाचा जी, आप जरा जल्दी स्कूल आ जाइए. चाचा जी स्कूल पहुंचते हैं. प्रिंसिपल सर, क्या माजरा है?
यहां पर हालत गंभीर है, कीटाणु ने परेशान कर रखा है.
ओहो, ये तो बहुत ही गंभीर बात है, जांच करनी पड़ेगी. आपके स्कूल का हाइजीन कॉर्नर कहां है?
हाइजीन कॉर्नर?
हाइजीन कॉर्नर स्वच्छता का संदेश देने वाला वो कोना जहां कीटाणुनाशक उत्पाद जैसे साबुन, हैंड वॉश, हैंड सैनिटाइजर इत्यादि रखे जाते हैं. बच्चों में स्वच्छता की जागरूकता नहीं होगी तो कीटाणु हमला करेंगे ही. ओफो, इस स्कूल में तो कीटाणुओं की सेना है.
भागो यहां से, वरना सब मारे जाओगे.
तुम्हारे विनाश का समय आ गया है.
अरे जहां गंदे हाथ और स्वच्छता, वहां हम 1 से 1000 हो जाते हैं.
अब क्या करेंगे चाचा जी?
डरो नहीं, बस फोन लगाकर इसका भी इलाज करता हूं. आप दोनों फौरन यहां आ जाइए. और कुछ ही मिनटों में शक्तिमान और फौलादी सिंह आ जाते हैं.
आपने याद किया चाचा जी.
हाँ शक्तिमान, फौलादी सिंह, स्कूल में तुम दोनों की तुरंत जरूरत है. वहां कीटाणुओं की फौज है. क्या करना ये तुम दोनों जानते हो.
हम सुरक्षा किट पहनकर तैयार हैं.
फौलादी, तुम कीटाणुओं को देखो. हम एक कोना ढूंढकर हाइजीन कॉर्नर तैयार करते हैं.
इन कीटाणुओं की तो ऐसी की तैसी करनी होगी.
अरे रुक, तुझे तो मैं अभी सुलाता हूं.
तभी शक्तिमान हाइजीन कॉर्नर का सारा सामान ले आया. फिर शक्तिमान और फौलादी सिंह ने साफ सफाई का काम शुरू किया और डेटॉल हैंड सैनिटाइजर और डेटॉल हैंड वॉश से एक एक बच्चे के हाथ धुलवाए.
ओफो, ये क्या हो रहा है? ये सफाई से हमारी शक्ति क्षीण हो रही है. अरे इन्होंने तो हाथ धोने और सैनिटाइज करने शुरू कर दिए बार बार. अब हम बच नहीं पाएंगे.
भागो और जान बचाओ, कीटासुर ने इतनी बुरी हार पहले कभी नहीं देखी, भागो।
आप तीनों का धन्यवाद हमें बचाने के लिए, पर यही कीटाणु सेना फिर से आ गई तो?
नहीं आ सकते, क्योंकि हमने यहाँ हाइजीन कॉर्नर तैयार कर दिया है। बच्चों, ये डेटॉल हाइजीन कॉर्नर आपको स्वच्छ और स्वस्थ बनाए रखने में मददगार साबित होगा और स्वच्छता बनाए रखने की याद दिलाता रहेगा। याद रहे, सब बच्चे आज से प्रण लें कि शौचालय का इस्तेमाल करने के बाद पानी डालकर सफाई बनाए रखेंगे, समय समय पर साबुन से हाथ धोएंगे और स्कूल के हमेशा साफ बनाए रखेंगे। साबुन और पानी से जब धोएंगे हाथ तो बीमारी फैलाने वाले कीटाणु नहीं पाएंगे पास। लेकिन हाथ सही तकनीक से धोना जरूरी है। हाथ धोने की भी एक तकनीक होती है। देखो,
हाथों को गीला करें, थोड़ा सा साबुन बनाएं, पानी से दूर अपनी हथेलियों को रगड़ें, हाथ के पीछे के हिस्से को रगड़ें, अपनी हथेली को नाखूनों से खरोंचें, अपनी उंगलियों और अंगूठों और उनके बीच की त्वचा को रगड़ें, बहते हुए साफ पानी से धोएं, साफ तौलिए या पेपर टॉवल से सुखाएं, हाथों को 20 सेकंड से 40 सेकंड तक धोएं।
बच्चों, अगर आप बीमार हैं तो घर पर ही रहिए। स्कूल में आपसे और भी बच्चे संक्रमित हो सकते हैं और सही तरीके से बार बार हाथों को धो डिटॉल के साथ और खांसते या छींकते समय अपनी नाक और मुंह को रुमाल या टिश्यू पेपर से ढांक लिया करो। इस्तेमाल किया हुआ रुमाल कूड़ेदान में डालें और उसके बाद हमेशा अपने हाथ साबुन और पानी से धोएं और खांसते या छींकते समय अगर रुमाल ना हो तो अपनी कोहनी की आड़ में छींके या खांसे ऐसे।
अच्छू! सही टिंकू, सीख लिया, वाह।
खुद को स्वच्छ रखें, स्वच्छ कपड़े पहनें, स्वच्छ आहार खाएं और जब पूरी तरह से ठीक हो जाएं तब स्कूल आएं।
हाँ, फिर नहीं फटकेंगे बीमारी फैलाने वाले कीटाणु हमारे पास।
अरे वाह, ये सब तुम्हें किसने बताया?
आपने ही, सपने में।
चाचा जी की इन बातों को कभी मत भूलना बच्चों। याद रखना, असली सुपर हीरो वही होता है जो स्वच्छता से रहे, क्योंकि जो स्वच्छ है वो स्वस्थ है। राइट? समझ गए? तो इसका सीख क्या है कि स्वच्छ रहोगे तो स्वस्थ रहोगे। तो अब जब स्कूल जाओगे तो ये सब बातें याद रखोगे ना? ठीक है ना? बिल्कुल। ऑल द बेस्ट। थैंक यू।
तो ये जावेद जी, ये आपने अभी यहीं बैठे बैठे आवाजें सोच ली?
हाँ, वो इतना छोटा फॉन्ट है भाई। तुम फॉन्ट देखोगे तो मतलब चश्मे के मतलब बावजूद इतना थोड़ा इसको बड़ा प्रिंट करिए ताकि बच्चे भी थोड़ा यूं झांक रहे थे। बट इट्स लाइक आई थिंक इट्स अ वेरी गुड इनिशिएटिव बिकॉज ऑडियो विजुअल मीडियम से आज पढ़ाई भूल गए हैं लोग। समवेयर कॉमिक बुक्स का जो हम पढ़ते थे हमारे बचपन में, चाचा चौधरी की कॉमिक्स, इंद्रजाल की कॉमिक्स होती थी। तो आई थिंक अब तो वो एवरीथिंग इज वन फोन एंड वही हो गया है स्क्रीन। और वो हम बोलते हैं ना, एक जमाने में जाप होता था, जो ऋषि मुनि या लोग भक्ति वाले लोग, तो अब 2 हाथों वाला जाप हो गया है। वो भी यही बस बच्चे उसी में लगे रहते हैं। सो आई थिंक जो ये पढ़ाई का एक इनिशिएटिव है कि कॉमिक्स के थ्रू, आई थिंक इट्स इम्पोर्टेंट कि विद द मैसेज द रीडिंग एबिलिटी इज ऑल्सो मेंटेन्ड। So yeah, it's a very nice initiative indeed.
जावेद जी का ये जो अलग अलग इम्प्रोवाइजेशन है, ये जो हमने पहली बार इसको बहुत ही विस्तार से होते हुए देखा, वो था टकेशी's कासल में आपके अलग अलग कुछ टिप्पणी आप करते रहते थे।
जी जी।
Which won you, I think, a lot of praise.
जी जी जी।
उसी का कुछ अंश यहाँ देखने को मिला।
Thank you।
बच्चों से पूछते हैं, बच्चों ने क्या सीखा? बहुत बढ़िया, बहुत बढ़िया।
तो ये अच्छा, मतलब स्वस्थ रहेंगे तभी स्कूल जा पाएंगे। तो जिसको गुठली मारनी है बोला सर मैं स्वस्थ नहीं हूँ, मैं बीमार हूँ, मुझे स्कूल नहीं जाना, तो ये मत करना। हाँ
बहुत बढ़िया। स्कूल में जाके हाइजीन कॉर्नर मांगोगे?
No, I think he said everything.
हाँ, एक लड़की का नाम है जीन, उसको तुम बोला हाय जीन।
जीन, बहुत बहुत बढ़िया, बहुत बढ़िया। These children all study in a school that has been one of the oldest partners of Reckitt's school hygiene program. The Prime Minister also visited their school recently, and these children were amongst those who sang Swachhata songs. In fact, gave him a hand washing demo, and 2 children even participate in the Hygiene Olympiad. The Hygiene Olympiad, the champions we just saw just a short while ago. Right. They are the embodiment of children as agents of change, and we've just heard how they are these agents of change. But Javed ji, आपको लगता है कि घूम फिर के बात वहीं आ जाती है, catch them young. जितनी जल्दी जो बात बता दी जाए उतना बेहतर।
Absolutely, it is extremely important because the impressionable age जो होती है वो यही 6 साल और 10-12 साल के बीच में, उसके बाद फिर वो कहीं, I think ये formative ages जो होती हैं, so these are the ones, and इसी समय में अगर बच्चों को ये आदत डालें कि एक तो पढ़ने की आदत, not इंटरनेट वो है, बट पढ़ाई की आदत भी, और उसके साथ ये जो लेसन्स हैं, लाइफ लेसन्स जिसको हम कहते हैं, कि किस तरह से अपनी ज़िंदगी में इन आदतों को डाल दें कि हर चीज़, स्वच्छता, पानी की बचत, सेविंग एनर्जी, ये सारी छोटी छोटी बातें होती हैं जो आगे बहुत ज़्यादा, जैसा आपने कहा जापान के बारे में, आई थिंक वो बचपन में बच्चों को ये इनकलकेट करते हैं इन चीज़ों से कि किस तरह से आपको अपनी जीवन को में इन चीज़ों को अडाप्ट करके फिर वो एक आदत बन जाती है, बिकम्स अ हैबिट। आई थिंक इट्स अ ग्रेट इनिशिएटिव।
अभी आपकी एक हाल ही में फिल्म भी आई थी जादूगर, जिसमें आप नीमच के जादूगर ढूंढ रहे थे, यूर द फुटबॉल कोच।
जी।
उसमें भी आपने सब लोगों को फुटबॉल सिखाने की कोशिश की, बच्चे बूढ़े जवान।
जी।
तो आपको लगता है ऐसा ही कोई जादूगर चाहिए जो कि बच्चों को स्वच्छता सिखाए?
आई थिंक कोच होता है, बट वो अलग है। बट माध्यम बहुत ज़रूरी होता है, एंड आई थिंक ये जो टेलीविज़न का माध्यम है, NDTV has taken this really great initiative, और ये एक it forms an impression, and I think today आज इंटरनेट माध्यम हो चुका है, और टेलीविज़न एंड the OTT platforms, ये सारे माध्यम हैं। As long as you can reach out, मेरे हिसाब से कोई भी माध्यम हो, अगर मैसेज सही हो और अगर इम्प्रेशन दे सके वो मैसेज, और रिटेन रख सके बच्चे अपने मन में और दिल में और जहन में, तो आई थिंक इट्स इम्पॉर्टेंट। और ये मैसेज भी कि किसी भी माध्यम में, किताब एक माध्यम है, हमें एक दूसरे माध्यम से कम्युनिकेट कर रहे हैं, तो आई थिंक ये इम्पोर्टेंट है, एंड वो ये माध्यम ही जादूगर है।
बिल्कुल,
इसका सही इस्तेमाल होना चाहिए।
हाँ, बिल्कुल।
थैंक यू सो मच।
बहुत ही लाजवाब।
आई मस्ट शेयर अ वेरी इंटरेस्टिंग एनेक्डोट। मेरे एक दोस्त ने कहा, इज अ काइंड ऑफ अ डॉक्टर, तो उसने कहा कि अपने घर को इतना स्वच्छ रखो कि स्वस्थ रहो, और इतना गंदा रखो कि मस्त रहो। So I think it was in humor, but it kind of works. So I think it's important. मज़े भी करो, इतना don't get obsessed. Yeah. Thank you so much. Thank you for having me and giving me the opportunity.
Thank you very much. Thank you, sir.
Thank you.
एक छोटे से ब्रेक के लिए यहाँ पर रुकते हैं, ब्रेक के बाद आएंगे और ये कार्यक्रम जारी रखेंगे। बहुत बहुत धन्यवाद आप सबका हमारे साथ जुड़ने के लिए। थैंक यू सो मच।
थैंक यू।
नहीं रुकेंगे, सबको स्वस्थ